Okay, so I'm here with Dr. Keith Progebin of Washington, D.C. We're going to ask him a couple questions about being a prosthodontist. So, Dr. Progebin, what is a prosthodontist, and if you could tell us a little bit about your day-to-day?
So, prosthodontist is a board-eligible or certified specialist. So, I specialty in reconstructive dentistry, restoring health, aesthetics, and function. And I interact with general dentists and other specialists to coordinate patients' treatment from single tooth replacement to full mouth rehabilitation. It takes a certified program, certificate program, which is generally 3 years, to do prosthodontics. Maxillofacial is another year on top of that, and there's an implant fellowship program, which is generally a year after doing your pros program. Yes.
So when does somebody coming in as a patient know that they have to see a prosthodontist as opposed to a different type of dentist?
That's a problem in the world of specialists versus general dentists. And as the average consumer, it's kind of hard to tell the difference between when I need a specialist or when a general dentist can do the job, adequately. There's something called the SAC classification. SAC, S-A-C. And it was developed for this reason in particular. It's called simple, advanced, complex. So if you have a problem and you're diagnosed and the solution or treatment is simple, pretty much general dentists should feel comfortable treating people with simple solutions to their problem. When you get on to the more advanced, maybe they need special or more extra training than just dental school. And some dental dentists feel comfortable doing surgeries, implants, and even reconstruction. When you get on to the more complex, which involves multiple disciplines, ortho, endo, perio, all the different disciplines, that's when you really need the help of a prosthodontist in dealing and coordinating all the different care. Mm-hmm. So SAC, simple, advanced, complex. And that way a general dentist goes, no problem. Single tooth, straightforward, maybe I want to tackle that. I take some advanced training, I could do that. Mm-hmm. Advanced, several teeth, I could do that. But it involves different specialties, and it's more complex, and that's when people want to come.
Yeah.
Or, for a prosthodontist, it's really the cleanup crew. 50% of what I do now is fixing other people's problems and other dentists' mistakes. So 50% of the cases I see are to help people unravel the problems that were created by dentistry. Mm-hmm. That's a problem.
So what sort of technologies are you using as a prosthodontist?
So I lecture on the digital solution. So as a prosthodontist, you can do an intraoral scanner to help you diagnose and treat, and treatment plan, and also treat. So for me, it's the analog and the digital world. Mm-hmm. Analog are impressions, either preliminary or final or definitive. The analog world is pouring up models. The digital world is taking those digital impressions, creating a whole digital workflow, and doing almost everything computerized. So that's diagnosing, treatment planning for parts, prostheses, everything. From single tooth to full mouth can be almost all done now in the digital world. Pretty amazing.
Yeah.
Conventional radiographs I still take, but most of my colleagues are doing digital radiography. Mm-hmm. So we keep on going back and forth from the analog world, which is what we've been doing for over 100 years, and now going into the digital world. So right now it's called, I live in an analog world, and I have digital islands. Mm-hmm. Islands where I use digital devices. You know what I mean?
Yeah.
I know you do.
How do you use the American College of Prosthodontists, and how are they beneficial to you?
Whew, very good. So I belong to the American College of Prosthodontics ever since I was a prosthodontic resident. In fact, the first day, Frank Panna, the director of our program and chairman, he said, as a prost student first year, I would treat you like a colleague, a prosthodontist. So I belong to the ACP and other organizations, but they have an annual meeting, they have a newsletter, they lobby for prosthodontics amongst the ADA as our specialty, and things like that. They do political things, they do informative things. They're very helpful. Mm-hmm. So I pay my dues, and I belong to the ACP.
And what drew you to prosthodontics initially as opposed to other specialties?
A mentor. It's always a person. It's always that person that says, you know what, I'm going to help you, and I'm going to lead you down the path. So Dennis Carnell was that guy. I was in my GPR residency program, which is a hospital-based program, a year or two after you graduate from dental school. So I was in my residency program, and Carnell goes, you have a brain, you have good hands, you have a personality, you need to be a prosthodontist. And I was like, Dennis, I don't have any money. I need to get a job. So he said to me, don't worry. I'll find you a job on the weekends. I'll get you teaching in the evening clinic. I'll get you into NYU. This is what you need to be.
Wow.
Because most prosthodontists are teachers, educators, chairmen of departments, publishers, researchers. Those are the people that are usually prosthodontists. You know? Yeah. So they become deans, chairman of departments, things like that. People that just don't want to do dentistry, but want to elevate dentistry for others to do better. Mm-hmm. That's what prosthodontics is about.
Well, thank you so much, Dr. Progebin, for taking some time to talk to us.
Robbie,